So this is a case of 29-year-old Malay lady, G1 Parao with 39 weeks of POA and with underlying GDM. So currently she's in the 30 minutes of active second stage of labor. So right now I'm going to deliver the anterior shoulder of the baby by doing a downward traction, but I failed to do. So this is case of shoulder dystocia. Dennis, can you help me to activate the red alert?
Okay, I'll inform the senior obstetrician, the pediatrician team, the NS team, and also call for the midwife.
Alright, yeah, I need to monitor the CTG of this patient.
I've activated red alert.
Alright, thanks.
Applied.
So now I need both of you to do the mat robot. Hyperflex both of the leg with hyperflex the knee and the hip of the leg and move to the chest of the mother.
Okay.
Alright. So I'm trying to deliver the anterior shoulder by doing a downward traction but still fail. Can someone to do the Rubin one?
Okay.
Alright.
Rubin one.
Alright.
Start applying pressure now.
I try to deliver the anterior shoulder of the baby by doing a downward traction and the upward traction to deliver the posterior shoulder of the baby. Alright.
Okay, so just now for the previous situation, we have done for Mac Roberts and also Rubin 1. So let's say if we fail to deliver the baby despite the initial maneuver, we proceed next to Rubin 2. So for Rubin 2, what we'll do is that first we'll insert 2 fingers at the posterior part of the anterior shoulder and we'll try to abduct the shoulder. So after the anterior shoulder has successfully been delivered, we apply a downward traction and also an upward traction to receive the posterior shoulder. And hence that's the Rubin 2. So if the Rubin 2 fails, we can try another maneuver, which is the corkscrew maneuver. For the corkscrew maneuver, we'll insert 2 fingers at the anterior of the posterior shoulder and the other finger will apply it at the posterior shoulder of the posterior of the anterior shoulder. Okay. So after it's delivered, we'll proceed with the usual delivery once the shoulder is released.
So after Rubin 2 and corkscrew maneuver is failed, so now I'll proceed to posterior arm maneuver. First, I would like to insert my 2 fingers into the birth canal and try to locate the humerus, the posterior shoulder, and try to locate the humerus and also the elbow. And then flex the elbow near to the chest wall of the baby and try to grip the wrist and then pull the wrist and then pull the wrist downward and then give an area at the pubic symphysis for delivery of the anterior shoulder and do downward traction for the anterior shoulder to deliver the anterior shoulder and upward traction for delivery of the posterior shoulder. Okay, now the baby is out.
So after all the maneuver had been failed, so we have to proceed with another maneuver, which is the Gaskin maneuver, where we have to rotate the patients on all 4. So I need your help, guys, to rotate the patient. This is to increase the pelvic outlet and release the gravity to deliver the baby. So same as a normal procedure of normal delivery and deliver the baby.